Hi, my name is Dr. Erin Milius, and I'm a board certified dermatologist. I've been in practice for almost 20 years and raised 3 children. So I want to dispel a lot of myths that you'll come across when it comes to various skin related conditions and also give you really practical advice. So definitely subscribe and ask questions in the comments below. And I'm happy to share my experience over these past couple of decades and seeing tens of thousands of patients over the past 20 years. Acne vulgaris is a state of medical diagnosis that describes a series of steps where your pores get clogged with excess oil, dirt, sebum that builds up inside of those pores. They expand, they get inflamed with the introduction of a bacteria on our skin called Cutibacterium acnes. That causes inflammation, they swell, they become painful or inflammatory, and they can even become cystic or nodular. This is a distinct entity, and with acne vulgaris, you'll see various parts of our skin affected. You'll see primarily the hormonal areas, say the face, upper chest, shoulders, and the V area of the back, but not necessarily the full extent of the back. Each of these spots will be in varying stages of development. They're not all going to be the same exact state of development, which is another clue to the diagnosis. So the other type of breakout that can affect our back, especially if it's the full extent of the back, there's another type of breakout called folliculitis or infected hair follicles. These will be a little different in that it will be the full extent of your back wherever a hair follicle can be. They can be oftentimes varying appearances. So you might actually see that they are all in the same state of appearance. It might look like goosebumps across your back where all of those pores seem a little bit swollen or inflamed. You can see pus bumps with this because if enough either bacteria or yeast get into those pores, it can inflame them. They'll often have a halo of pigmentation around them, which tells you how much inflammation is deep under the skin. And these are a little different because this is not necessarily hormonal. This is the one that bugs me the most because a lot of people may misdiagnose or give odd recommendations. Like I've heard even some of my colleagues tell people that, well, it's probably because your hair is still wet and you don't dry it immediately after your shower. There is zero data that supports that theory. But the one thing I always have to say, because again, after 20 years of seeing patients and seeing them in varying ages and seeing varying, hair lengths, it's really not that just long-haired people get acne on their back. Just about everyone can. The one thing that I am seeing over the years, because I am seeing an uptick in acne in the past 20 years, acne on the back in particular, is there's probably a connection between the clothing, textiles, bed sheets, and even our laundering practices, because laundry machines have changed over the years, laundry detergent has changed over the years. That is probably affecting the skin on our back a little bit more uniquely. What we're finding more and more, especially I am a textile expert, I work with functional textiles all the time. More and more we are finding that polyester and other types of synthetics are used in clothing items for a couple of reasons. There's a lot of benefits there. They can be added UV protection from polyester types of fabrics. They can moisture wick or get sweat or moisture away from our skin more effectively. But there's also a downside because as hydrophobic as those fabrics can be, in that they resist moisture buildup so that your garments don't seem as wet or soggy like cotton can be, they also retain a lot of lipophilic products, which would be oils, dirts, and sebum. That means that when you're wearing those, especially overnight, and there's long stretches of time between your clothing contacting either your pajamas or your bed sheets, that the oil can build up in the fibers of those fabrics. This means that we need to consider our laundering practices for those products, because if there's a buildup of that residue in the fabric, that can serve as a location for bacteria, yeast, and other microorganisms to overgrow. That can sometimes either directly lead to infections or inflammation in your skin, or indirectly by changing or altering the pH of your skin, making it more prone or susceptible to inflammation that can again lead to these breakouts on the back. These are not acne after all. These are folliculitis or infected hair follicles. Bacteria, yeast, and other organisms can be at play. Frustration here is sometimes our traditional acne products may or may not work, because a lot of them work by exfoliating. Maybe you'll get a little bit of a benefit, but the pores on the back are really deep. You know, when you cut through the skin, when I'm doing excisions, it can be a quarter of an inch thick, half an inch thick. Those pores run really deep, so we can't always get topicals to penetrate into the skin effectively. So we need to work with the skin's natural bioflora. We need to work with the skin's natural community of bacteria, yeast, and other organisms, and try to alter that to really make it a less friendly place for these organisms to overgrow. Part of this comes down to, one, your cleansing practices and what you use in the shower. So we want to make sure you're using a cleanser routinely that can degrease the skin. But even more important than that, when it comes to acne on the back, is considering your laundering practices and the types of products that you're wearing to bed. Now, I am not a proponent for wearing silk in pajamas because they are very hard to maintain. And again, studies do not support silk itself as the actual fiber that you should be choosing. It's really silk-like fabric, so things with a softer texture or feel, but more importantly, how you wash them and the composition being things like cotton and other types of materials that actually do not hold on to those oils as effectively as polyester types of fabrics do. When it comes to considering cleansers to choose for acne on the back or breakouts on the back that may not be directly related to acne vulgaris, meaning clogged pores that result in those breakouts that might require other ingredients, consider products that are designed to pH balance your skin in such a way to make it a less friendly environment for yeast, bacteria, and other microorganisms to overgrow. Remember, we can't just deplete our skin of these organisms because we've got good bacteria, bad bacteria, we've got good yeast, bad yeast, and there's a balance that we need to strike. So you don't want to be so aggressive as to over dry your skin out. Same types of ingredients that we use for things like dandruff in the scalp can actually be beneficial for breakouts on the back that are linked to this type of folliculitis or infected hair follicles. There are ingredients out there like zinc pyrithione, as well as selenium sulfide and sulfur-based products that are really effective at serving as agents that can actually protect your skin and create a balance in your skin that make it a less friendly environment for yeast and bacteria to overgrow, and or at least control the populations of these microorganisms while still effectively degreasing your skin but not going overboard at doing so.